Hi, my name is Dr. Del Grosso with SF Chiropractic, and I'm going to talk a little bit today about disc injuries or disc herniation. You hear all the time, people are always hearing, oh, disc bulges, disc herniations, a bad disc, especially if you've been in an accident, an MRI so we can evaluate, see if there's a disc problem. So let me give you a little head start, so if you ever do have an MRI, you'll have a better understanding of what is going on. If you hear the word bulge or herniation, you'll pretty much know what it is, okay? And the doctor won't have to be so intensive about it, and you'll understand a little bit better. First off, your disc, and I'm going to use a little example here, your disc is a little cushion that's between the vertebra, okay? That disc and the curves in your spine are what kind of help absorb the load of your body weight and everything through your spine, which is your structure, okay? A disc is like a rubber band around the outside, a very thick rubber band, and in the center there's kind of a soft jelly center, almost like a donut, okay, like a jelly donut. That center remains in there and is soft like that, so you've got this pliability, you've got this, cushion inside there, okay? When you hear that a disc bulges, remember, if you put a lot of compressive force on this disc, and here's an example, there's the soft center, here's the fibrous outside. If you put a lot of pressure on that disc, sometimes what can happen is that center's got to do what? It's got to expand, that soft center. And if it starts to expand and there's any weakness or anywhere on the disc, which usually inherently there is, it'll force itself into that area. Okay, when you hear a disc bulge, basically what a bulge is if I take this disc, okay, and I put some pressure on it, and put pressure, it's almost like putting pressure on a water balloon. And when you push down on a water balloon, what happens? It bulges out all the way around. Here's an example of that. Okay, if I don't break that. Here's an example. Here's the disc, and as we put the pressure on that disc, what happens is, as the pressure, it pushes out a little bit, you'll see this side's bigger than that side. It bulges out. Okay, just like pushing on a water balloon, it's going to bulge out. Now, depending on where that soft center expands, tells us where it's going to bulge and where it's going to push out a little bit, okay? As far as a disc is concerned, if there can be bulging anywhere. Can be anywhere on the disc. If the bulging is in the anterior portion of the disc, guess what? It really doesn't mean a lot for you. It's not really a problem. The problem is when it occurs here in the posterior portion of the disc or off to one side or the other, okay, where those nerves come out of, where these openings are for the nerves and where those nerves come out. So I'm going to open this up, and the problem is when the disc pushes out on either side here, in the middle here, where it can affect the sac. The biggest issue is if it pushes out on the corners, because that's when it takes up the space that the nerves pass through. Okay? So that's a bulging disc. If you hear a bulging disc and it's broad-based, it means it's bulged over a large area. If it's anterior, it doesn't mean anything. It's only if it's posterior that's a concern for you, okay? The next step from a bulging disc is what we call a herniated disc, or an HNP. Okay, you can also hear it called a disc protrusion. They're all pretty much the same. Okay, a herniated disc is when this center here starts to push out and those fibers in the outside of that disc are weak enough that it actually pushes out and forms a separate little pocket, just like this. Okay, this little pocket, that's what a herniation is. There's two types of herniations. There's one that's a pocket and enclosed like that. There's also another herniation which is called an extruded disc, or an extruded, and that's where the fluid actually pushes out and actually ruptures and leaks out into the free space. Again, these are a concern when they're where? In the posterior part of the spinal canal, or where those nerves come out. If they're not in either one of those areas, they're really not a concern for us. If you have an anterior herniation, it doesn't mean a whole lot. It's still a problem. It's still something that shouldn't be there, but it's not as big a concern. The concern is when that disc, just like this is a simulation of a herniation, is pushing out in the space where this nerve comes out. Because now, depending on how bad it is, how restricted that space is, it's going to affect the nerve and the function of this nerve all the way down to where its ending is. Okay? So briefly, that's kind of an explanation of what a herniated disc is, or what a disc injury is. Okay? Not all disc injuries have to be bad. Most of them should be addressed. One of the things that you've probably heard of before is decompression. And decompression, short of intervention, is probably one of the best things